Angiogram with possible angioplasty or possible stent placement. Lower extremity. Introduction. Can you point to the iliac arteries? Choose one of the following options. Correct. These are the iliac arteries. This procedure is usually done while you are awake. Select true or false. Correct. This procedure is done while you are awake, instead of asleep under general anesthesia. There is very little pain. Because you are awake, you should hold as still as possible to help the doctor get clear pictures. It is normal to feel some warmth in the leg when the contrast is being injected. Select true or false. Correct. When the contrast is injected, you should feel some warmth in the leg. X-rays are safe for pregnant women. Select true or false. Correct. X-rays are not safe for unborn children. Therefore, you should tell radiology staff about even the remotest possibility of pregnancy. A pregnancy test before the angiogram can be performed in case you are not sure. It is impossible to injure the blood vessels along the path of the catheter inside the body. Select true or false. Correct. Even though this is rare, an injury to the blood vessels inside the body can lead to internal bleeding and may require immediate surgery to save the patient's life. The nerves going to the legs or arms could also be injured and lead to paralysis and permanent decrease in sensation. However, these complications are very rare. Infections are rare after this procedure. Select true or false. Correct. Infections are very rare after such a procedure. The contrast used in this test could possibly cause allergic reactions or kidney failure. Select true or false. Correct. These are rare. Unfortunately, either of these complications could lead to death. It is therefore very important to tell your doctors about any allergic reaction you might have had in the past. You should tell your doctor if you are on glucophage. Glucophage may need to be stopped around the time of the procedure. The angioplasty is always successful. Select true or false. Correct. The angioplasty is not always successful, and surgery may be needed to open up or bypass the blockage. The angioplasty could lead to a complete blockage, which would require urgent surgical intervention. Thank you for using Explain.